You're listening to Radio Kidnappers, the voice of Hawke's Bay. This is the Acupuncture On Air program. Our pleasure, as always, to have in the studio Heiko from the Acupuncture Clinic in Hastings. How you going, Heiko?
I'm very good, Ken. And I said, you're still wearing a jacket. Do you know how hot it is outside? And
it's hot in here.
It's not even 9 o'clock yet.
Trotters underneath the jacket. I've got my regular old USA T-shirt on.
Yeah, so that's all right. We like to keep Trump happy and proud.
Yeah, too right. Roll on, Donald. The Donald. We love him.
Yeah, and it might be a coincidence, but we're talking about Post Concussion Syndrome. I don't know whether that's to do with Trump or not, but it's certainly a hot topic because a lot of people. As you know, acupuncture treats everything.
It does indeed, yeah. It's nothing that it can't treat, everyone.
And so some people think, well, is it going to treat this problem as well? So, and I thought it's a good opportunity to just get that information out there to let people be aware of the potential of acupuncture.
We say that do we even say it jokingly every week that acupuncture can treat everything? I set people up sometimes for a bit of a fool when they say, okay, well, treat this, buddy.
Yeah.
Do you ever have to say, you can't do that?
Yeah, there are things, and it's sometimes the reality is that patients they're on 20 different medications and they had surgery and they're having 10 different side effects, symptoms from the drugs. There is a limit to sort of how much of a result that you can expect. So I don't want to give it out there that you can have a couple of sessions and then hallelujah
you're saved.
But it's but certainly there's lots of conditions that acupuncture can do. And what's interesting with the post concussion syndrome is that acupuncture is very effective for it. And of course I am biased that acupuncture is good for it. But the reality is there's not a lot that Western medicine can really offer if they're really realistic about looking at their treatment options.
Exactly. And of course concussion is paramount at the moment in the news because of that unfortunate fellow who just passed away for that charity boxing match he was in, that concussion there. I mean, it's a very serious thing, isn't it? We've got to sort of look at what we're doing and what should we or shouldn't we be doing, hit to the head.
Yeah, and I said, and they can be very simple. I mean, I said, and I mean, I've had patients where they've just slipped in the kitchen, slipped backwards or sideways, hit their head, as well as there's more serious ones like with a car accident or a tradesman, a brick or something falling on their head. These ones are sort of more dramatic, but sometimes it can be just from the most simplest little thing.
What are some of the symptoms of
some of the symptoms are, I have to look on my sheet here because I forgot. No, but one of them is forgetfulness and memory loss, and that can be quite debilitating for the patient because the patient sort of like, they're used to being able to remember things and to do things, and suddenly it's like they know that they have to remember it and they know that they should know that, but they just can't remember it. And
could you put that into just as an aside though? I mean, as you're getting older, that just sort of that happens to you, doesn't it?
Of course there is that sort of gradual thing, but this is where suddenly overnight it's just like it's quite dramatic. And the other one is the ability to concentrate. Like, I mean, I've got patients who they might have always read a novel after their dinner at night, read a couple of chapters to, read the latest Tom Clancy novel or whatever, and they just can't because it's just so difficult to concentrate on that thing, and they might read the first or second sentence and then they've forgotten what they've read, and then they get tired from reading and trying to concentrate. So how does that affect people in their work? Like if they have to be typing in data entry and being a receptionist and all that, it's they lose their jobs as a result of that.
And just one more aside. I mean, you can get concussion not necessarily from banging your head, but you can get concussion from, say, whiplash.
That's right, from whiplash.
So it doesn't actually have to be a physical bang to the old.
And of course, and I was going to mention it later in the show, but you can also get brain damage from one from I won't say medications, but recreational substances, and LSD and these type of things that actually do damage the brain, and you end up with some of these other symptoms such as dizziness, lightheaded, coordination problems. They get clumsy, they drop things, they walk into the hallway, things like that. sleeping problems.
Yep.
Not just because of the pain, but it's just, it's affected their head.
Yeah.
And of course this causes them to be unemotional, in control as they've been, and get irritable, get frustrated, get angry.
Jeez, that list sounds like me.
Yeah, I was going to say, it sounds like a lot of us, And
we haven't been hit on the head.
Yeah. So,
we haven't explored, actually, and I guess it's a whole other show, but we haven't explored, because you mentioned it, drug abuse.
Yeah.
We haven't explored the use of acupuncture for drug abuse. Is that a goer?
Yeah, and it would make another interesting show, and we'll definitely talk about and what could be involved with a rehabilitation.
Yeah. Okay, getting back to concussion, I understand that in Napier we've got a support group that meets at the Stewart Centre at EIT.
That's right. Yeah, and I've done a talk there. It would have been maybe 3 or 4 years ago, and the people going there were quite serious. Concussion people had serious accidents and quite dramatic problems with their memory and their confusion and those type of problems. And be it that many of them were interested in having treatment.
Yep.
It was the cost of it, and also the fact that a lot of the people had to be driven to the support group, and even had other support persons helping them to remember that they needed to go. So it was like, but again, it's one of these things where I think the government / health board, you could set up a treatment place, and it would be quite cost effective.
Indeed. What's the alternatives to getting acupuncture? So if we can't afford to come and see you, or can't get to come and see you, and we're relying on some sort of treatment?
As I said, I'm a bit cynical about the Western medical treatment, as you know. But really, it's painkillers for the headaches and often they give a drug. It's gabapentin. It's a very, very strong painkiller. But most of my patients who are on that, like, they hate being on it or won't take it because it has so many other horrible side effects and makes them feel worse. They said they'd rather actually have the headache than how the drugs make them feel. There's other, they send them. This is like with ACC, they'll send you off to do various, psychological assessments, and then I say, well, what did you do when you were this? There was a square piece of paper with a hole in it, and I had to look at it with my left eye and go backwards and forwards, and then look at the thing, and all that did was make me feel frustrated and irritable, and after the thing I felt exhausted, and it took me 4 hours to recover from it.
I was reading those notes that you sent through, and when I read that part, it sort of took me back to like a 1950s sci-fi movie where I thought, I could really, is that what they do in this day and age?
Yeah, and I said I've had other patients that they end up, ACC sends them off to a therapist, and the patients obligingly, because they have to go, sort of to be cooperating with ACC, and one of them said, he's talking to me about my childhood and my stress of my childhood, and I said, I fail to see what's it got to do with my whiplash.
Yeah.
It's purely a physical thing, and whether I was unhappy or happy in my childhood is irrelevant.
Yeah.
But I guess the psychologists think it is relevant, and then it's in that system.
Yeah.
So then they go through and they do their 10 sessions or whatever it is, and ACC spends a lot of money.
They would spend millions, wouldn't they?
Well, it's hard to say, but I know with some of my other patients who have been through that process, I just sometimes think of the costs that they get, because they were also, ACC's paying for the taxis to go from Havelock to Napier and back again, and then
some people might think it's sour grapes, though, that you're sitting here saying the government's paying all this money, and they could be paying the money to send them to see you. Same difference.
But the thing is like, I know with a number of my patients, and the reality is, you can look up all the stats about post concussion syndrome and brain damage or whatever. It can be a 3 to 10 years recovery time.
Wow.
Right?
Incredible.
It's at least 18 months for mild concussions, let alone it's 3 years and then more for others. So, ACC and especially the insurance companies, they're hesitant to want to fund or pay anything for that, because it's not like a simple, a little bit of acupuncture, a little bit of rehabilitation at the physio, and then your shoulder's right again.
Is that time frame for treatment the same with acupuncture?
No, well, that's the thing. I think the acupuncture can rapidly accelerate that, but then because it's the weight is in the system, the ACC will only pay for a certain number of treatments.
Yeah.
And then it becomes like, oh, well, we've done that, so now we do something else. And it's quite, from my point of view, it's quite frustrating, and from the patient, is because the patients have had these interviews with the ACC case managers and maybe some other advisor, and they say, oh, look, this has been your program, we've been to this psychologist, you've done this test, we've done this scan, you've done this, you've been to this specialist, you've done all this, and you're just talking mega thousands of dollars.
Absolutely.
And then they say, and what do you think is helping the most? And the patient said, acupuncture. The acupuncture is actually the only thing that's helping me. And then they'll go, oh, well, we might send you to the pain clinic in Palmerston.
Yeah.
Right?
Yes.
And it's like, well, what about some acupuncture? Oh, well, you've had some acupuncture. So, yeah, but that's the one that's helping.
Yeah.
And it's like, oh, no, but, you've done your course of that.
Yeah.
And look, just from a dollar for dollar point of view, I mean, the trip to the specialist, the other paraphernalia, if you like, associated with going to go to the doctor, back to the thing, the report, then wait for the specialist, taxi fares backwards and forwards and all that. There's not much change over $500 or $600 for a 15-minute consult.
Yeah. Have you knocked on their door? Have you knocked on the door of the ACC and said, look, this is working, why are you sending to me?
It's a hard one. So, and then I say, that's about 10 acupuncture sessions, right? 3 weeks or 4 weeks of acupuncture in reference to a 15-minute consult where the only outcome was, well, let's increase your gabapentin medication.
Yeah.
But that's the system. That's how it is. And you try to go to ACC about it, and they say, oh, where's the research paper?
Yeah.
We want a research paper that's less than 2 years old with a double blind. We're 100 people, and it's been written in the British Medical Journal that it helps. And I said, well, yeah, I haven't got one. Oh, well.
Yeah, then get out. Do you think people listening to this program or watching you on YouTube, because you're world famous on YouTube as well, do you think they might be thinking that you don't use any Western medicine at all? Do you take any pills that a Western doctor might prescribe? Or
I personally, I don't. And
do you use acupuncture for everything?
Acupuncture and herbs, but I have once used a fungal cream on my toes. Right?
Let's not discuss that any further. Yuck! It makes me want to feel sick. Okay, so let's get down to the real oil. So if we've got mild concussion or serious concussion, are you going to stick needles in our head?
And that's there actually are some points that I do use in the head, and other acupuncturists might. There's a like a specialist area of acupuncture, what they call scalp acupuncture. Which is used especially for memory, concussion, insomnia, stroke rehabilitation, and so forth. So they do that, and we have had a specialist from China who's come in and given seminars in Auckland on this.
Yep.
And many of our members have attended the workshops, and then we have also points away from the body again.
Yeah, as always. So you can put it in your foot.
In your foot or your hands, the back, the abdomen, it depends. Because we say that any injury, whether it's a hit to the shoulder or to the head, we say that you get stuck blood, stuck energy in that area, inhibited circulation that prevents recuperation and recovery. So then we have points that might be in the leg that we say help promote blood circulation, or points that move stuck energy, and that's part of the healing recovery process.
I suppose you wouldn't use moxibustion unless your patient was bald, because you'd set their hair on fire, wouldn't you?
No, you can actually do moxibustion on the head, and there's a point that they commonly do right on top of the head.
Yeah.
And but you hold the moxa with this in like a cigar stick shape type of pressure, and you might be holding it and you're moving it backwards and forwards, maybe 2 centimetres away from the point, so you'll feel a little bit of heat on the head, but it doesn't burn the hair or whatever. No. And otherwise we use moxibustion. There might be points on the leg, on the abdomen, on the back.
Yeah. What about Chinese herbs?
And again, Chinese herbs. There's actually been quite a good book in English now, being translated from a Chinese text, and it's specifically for post concussion syndrome and for acupuncture and herbs. And we have, for example, there's a whole chapter of herbs that we say that they mobilise the blood, and they're used for conditions where the blood circulation is blocked or inhibited in some way in certain areas, including the brain and the head.
All right, Heiko, that's fascinating as always. So if you want to come and see about some acupuncture, moxibustion, or Chinese herbs to do with post-concussion, or in fact any other ailment
every
that one
other
could
ailment,
think of,
except for itchiness between the toes. We probably just get some fungal cream for
that's
that.
Right. And go to the chemist. How do we get hold of you?
You can go to my website, acu123.co.nz, and I'll have a link on there on my YouTube channel. Otherwise, you just harass Ken, ring him at the station. And thank you very much. We've had a couple of calls this week, and one lady, was it from Wairau?
Yes, it was indeed. Yep. Looking for some help.
So I'm sorry I've forgotten her name, but hello.
Hello to Wairau. Yes, indeed. And like you say, they can visit our website. They can call us, or they can call you. What's your number?
It's 06 876 3666.
And where's your studio?
206 Charles Street, Hastings, just near the Pack and Save. Or see my friend down John, who's also running his acupuncture clinic down there, in 49 Church Street, Masterton. Got
another weird song?
Another. I thought this would be on the the OK list, right? I mean, I guess it's. I hope it's not unpolitically correct, but the song that I've chosen is Brain Damage from Pink Floyd.
Yeah, and I must say I never really was a fan of Pink Floyd.
Oh, really? Well, if I would have known that, we've never started this program.
But I actually know someone who's not a fan of the Beatles.
Really? Now that's weird.
And they are our age, this person, but I mean, I suppose...
He doesn't have, like, concussion, forgetfulness and dizziness and stuff like that, does he? That might be the reason.
Yeah, this track originally, by the way, was going to be called Lunatic, so it might not have been very PC back then. And like you say, it's off the album The Dark Side of the Moon, and it's sung by Roger Waters. That's probably all we need to tell you, isn't it?
And apart from it's from a great album.
Yeah, it's from a great album, which you can get from Electric City Music in Dalton Street in Napier. Here it is.